thank you for clicking on this link to watch your post-op instructions. Here are the main things that I'd like you to consider, please, since you just had your procedure. The first thing has to do with eating. We would like you to be properly full with nutrients, and this is not a diet regimen. With that said, please be mindful to avoid anything that is hot or contains any sharp or small pieces or any particles that may get stuck in the area of surgery. We do prefer that you consume cold and soft foods such as yogurt, mashed potatoes, mac and cheese, and so on and so forth, typically either cold or room temperature. As you go past day 3 from your procedure, you can start introducing warm foods. Please avoid hot liquids, including hot soup. That may induce bleeding, and that's the reason why I would like you to be careful with the heat. You probably have some sutures in your mouth. Some of the sutures may be resorbable, some may be non-resorbable. In any case, please do not try to pull your sutures by yourself, try to trim your sutures by yourself or with somebody else. Please leave them alone. Let us know if a suture comes loose or if you lose a suture. It's typically not a big deal, but it's good for us to know that. Please avoid brushing. Avoid brushing the sutures or flossing or water picking or any other oral hygiene regimen on the area of surgery. We would like you to brush the rest of your teeth. For example, if your surgery was on the lower jaw, you can certainly take care of your upper jaw normally, and vice versa. So don't avoid brushing your teeth completely and cleaning your mouth completely, just the area of surgery. We will clean the area for you when you come back for your suture removal, and we will also incorporate and introduce different ways of oral hygiene on that particular area when you're back for your suture removal. For discomfort, because discomfort is unfortunately one of the issues that we have to undergo when we're having surgery. Discomfort is not a complication. It's part of normal healing and how our body is experiencing that normal inflammation that takes place on a surgical site as it's healing. Most of the times we will have prescribed for you a certain regimen of the medications. 90% of the cases, these include ibuprofen and Tylenol. Of course, there are patients who cannot take that and we alter our regimen. Those medications would typically alternate every 3 or 4 hours for the first 3 or 4 days, so you're comfortable. If you're careful with your diet and you're taking care of your medications that also include antibiotics, please take your antibiotics. Do not forget that important prescriptions. Then the next thing that I'd like you to be mindful of is apply some ice outside the mouth with an ice pack wrapped with a soft towel for the next 2 days, for the first 2 days after the procedure. You can do that 10 minutes on, 10 minutes off. If you develop any bruising, and we do have patients that are on blood thinners and may have to stay on blood thinners despite our wishes according to their physician, you may also experience some bruising. Typically, bruising starts after day 3. So first 2 days you can use the ice packs. After day 2, as you go into day 3, you can switch the ice pack to a warm towel or a warm compress and apply it on the same area. That will help dissipate the bruising a little sooner. Please be mindful that swelling is not a complication, especially when it comes to grafting procedures. These procedures typically do create a lot of swelling. Most of the swelling will be at its peak on day 3. So if your procedure was on Thursday, you may have plenty of swelling as you go into Saturday night and Sunday morning. Do not be alarmed. That is normal. Swelling is also most evident when you wake up in the morning. That typically has to do with the fact that you've been laying flat or didn't have your head propped up enough. So there's definitely more blood supply on the head and you see more swelling. So swelling is something that we need to be aware of, but we'll also let you know that depending on what procedure you're having done, you may experience some more swelling versus less swelling. Ice typically helps with that. So here we are, we covered medications, we covered diet, we covered oral hygiene, and we discussed briefly about what to expect when it comes to swelling and or bruising. Other practical advice includes sleep with your head propped up. Avoid sleeping on the side that you had surgery on. Try to sleep on the other side. Use an extra pillow or sleep on a recliner. Do not use your best linen because there may be some oozing and some minor bleeding. That is to be expected all the way up to 48 hours post-procedure. Don't be alarmed. A little bit of bleeding in the saliva looks like a lot. Of course, if there is profuse bleeding, please let us know. All surgeons here at Synergy will provide you with their personal cell phone number, and typically we do call you the night of surgery, if not the next day, to check on you. So you will have access to us throughout your post-op period, and please rest assured we will address any concerns you may have. I know you're going to have a great recovery. Take it easy, and we look forward to seeing you at your follow-up. Thank you.